Memorial Day weekend is coming up, and this year it'll look a lot different. This will actually be the first maskless holiday since COVID began. So joining me now is medical editor Dr. Dave Hnida. And Dr. Dave, for the past year, we've been telling people to stay home on holidays. So what should people be thinking about this Memorial Day?
First off, I think I would be very pleased about the fact that we have had such effective vaccinations. It changes everything. I mean, look at a year ago. A year ago, we were telling people not really to have get-togethers. And if they did have gatherings, limited the number of people. We were telling folks that they really should not even be sharing food, not sharing utensils, not touching things. And then you fast forward to a year later, and what a difference. But nonetheless, it's important to recognize we're still not out of the woods. We still don't have everybody fully vaccinated, at least to the level that we would like to have. And so I think there needs to be a little bit of thought in terms of your Memorial Day gatherings. I think that when you consider the fact that there are outdoor activities, much lower risk. Great. And that's a really positive at this point in time. But then when we go to large gatherings, mixing of vaccinated, unvaccinated people, indoor settings and so forth, definitely unvaccinated folks really should be masked up in that particular situation. This is kind of an important one too. Think about this, whether you've been vaccinated or not, if you are going to some sort of a gathering or get together for Memorial Day, please do not go if you are sick. We are now starting to see other illnesses circulating through the community besides COVID. And so it really would be good not to expose others. Also, take a look at your personal risk ratios, we call them. See what you are looking at in terms of what your own risk is, in terms of your underlying health factors. Take a look at people in your family who may be non-immunized or people who have underlying health conditions, poor immunity, and certainly keep in mind the fact that children are unimmunized at this time. So a lot of safety here. We're not out of the woods, but certainly looking a lot better than we were a year ago.
Right, and the race to vaccinate continues in Colorado. You were just mentioning this. The state's focus now is on making sure kids aged 12 to 15 get vaccinated. So what about younger children? Will there be a vaccine for them at some point?
Well, Pfizer is coming out right now and saying, yeah, there will be a vaccine for young children as early as September. That seems a little bit optimistic. Most public health experts are saying more realistically, maybe we should be looking at December. It's interesting to see how they're breaking down the testing. They are essentially going into 3 age groups when it comes to younger children. There is a 6 through 11-year-old age group that is being tested, ages 2 through age 5, and then 6 months to 2 years of age is the third age group that's being tested. So there's a definite breakdown, and it's important to recognize that we're testing as young as 6 months of age. And so really the way that the researchers are going about this is they're not really basing the use of vaccine in minimal, small doses. They're thinking that actually what they'll do, especially when you take a look at the ages 6 through 11 age group, they're actually starting to test the adult dosing with that age group. You go with the dose that is most effective, and then you begin to drop it back and you use the least amount of vaccine that is effective. And that is because kids have a very robust immune system. They really do react to vaccinations very, very well. So when you take a look at what an adult is given, and typically it is 30 micrograms spaced out several weeks. In children, it may be as little as 5 micrograms or 10 micrograms. And it's not because of their age, it's not because of their size. It is, once again, due to the fact that they really have a more robust immune system than adults do. So we'll see what happens as we go through the rest of the year.
Great. And so let's talk about variants. The India variant of coronavirus has been discovered in Colorado. Is there anything different about this one that we need to know about or be concerned about?
It's interesting because when you think of the India variant, there are 3 things that come to mind that really make it a little bit scarier. First off, you automatically think, well, this is the major strain that's circulating through India, which is a country that is just being devastated by COVID deaths at this point in time. Number two, the India variant is actually a variant that is a double mutated strain, which really sounds frightening. It is actually a combination of a California variant as well as a South African variant, but that fortunately does not make it any deadlier than any of the other variants that are out there. It is more contagious. And the third thing that makes it a little bit scarier is, yes, it has been found in Colorado. Initially, there was one case in Mesa County that is now in double digits, and we know that it's got to be in areas throughout the state, especially areas of the state that really are under vaccinating at this point in time. And that really is the key here. This is a more contagious strain. We do know that this strain, as well as other mutated variations, do respond to vaccinations. But the key point here is when you look at vaccinations, if you do not get a vaccine, you are unprotected. And therefore, when you really consider how do you keep variants and mutated strains under control, as you get the virus out of the community. And that's why getting vaccinations done, especially in younger age groups, because it is young adults who really are driving the infections at this point in time. I think we really need to get more folks vaccinated. And I think that we can then begin to look forward to a little bit more freedom in terms of our activity and what we can do safely.
Great information. Thank you so much, as always, for joining us, Dr. Dave. We really appreciate it. And we'll talk to you again next Monday at 11 a.m. to get more coronavirus and vaccine questions answered. We'll be right back.